July 1st of last year is a date that lives in infamy for animal lovers. CBS News correspondent Dan Raviv.
On this first anniversary of the famous lion in Zimbabwe, Cecil, being killed by an American trophy hunter who used a bow and arrow, a group called Born Free USA is pushing for more animal preservation agreements and regulations.
Born Free will be leading the charge at the upcoming Convention on International Trade and Endangered Species in September, meeting down in Johannesburg, South Africa, where we'll be looking for an increase in global protection for African lions. So there's definitely still work to be done in Cecil's name and memory.
Adam Roberts, the chief executive of Born Free USA. Dan Raviv, CBS News.
Taiwan says one of its patrol boats fired a supersonic anti-ship missile by mistake. The missile landed harmlessly. Officials say the patrol boat's operators may have failed to follow proper procedures. Frank Sedapani, CBS News.
The Ford Freedom Sales Event is on. It's our biggest event of the year, giving you the freedom to save. Now get 0% Ford credit financing on a huge selection of Ford cars, trucks, and SUVs. Plus, specially tagged Ford vehicles get 1,000 smart bonus cash. That's freedom from interest and freedom to choose from Ford Focus, Fusion, and Escape. Even Ford Edge, Explorer, or the Built Ford Tough F-150. No wonder Ford is America's best-selling brand. During the Ford Freedom Sales Event, get 0% Ford credit financing on a huge selection of Ford vehicles. Plus, specially tagged vehicles get 1,000 smart bonus cash. Not all buyers qualify for Ford Credit Limited Term Financing. Supply of vehicles with smart bonuses limited. Not available on Focus RS, Shelby GT350, Transit, Transit Connect, E-Series, F650, and F750. See dealer or go to Ford.com for qualifications and complete details. For all offers, take new retail delivery from dealer stock by 8/1/2016. Sales claim based on 2015 calendar year sales.
Good morning and welcome to another great edition of Younger Life Live. I'm Rick Federici.
And I'm Mary Anthony.
It is a great day to be alive right here. I love this. It's a holiday weekend. Are you ready for it? I
am.
Or what?
I'm excited. Nice long weekend, beautiful weather, so much to do. You know, it's exciting.
Okay, so with this exciting weather, craziness going on in our backyard right now between Southwest Michigan, Northwest Indiana, Chicago, up along the lakes and the Great Lakes. Be careful with this one. We do have a beach hazard statement, which means please stay out of the water. I mean, you know, pure and simple.
Just to,
for now.
Again, nobody wants to keep us out of the water. The health department, they want to get us back in the water as soon as they can, but they also have a responsibility to let us know when it isn't safe. So abide by that.
Yes.
Listen to that. There's a reason for it.
Now, the other thing I want to throw out there too, with some of our local lakes, we're not going to name them, some of our local lakes, the LaPorte County Health Department, who's also been on this radio show and Younger Life Live here, they threw out a swimmer's itch reality check. 20,000 of you already touched it, and over 300 of you have shared what we have up on Facebook.
Right.
So I'm just kind of letting you know it's pretty big. So
and I
think
I think that the health department website itself will list all of these issues that are going on. So if you are not sure, check WIMS Facebook page or check with the health department themselves.
Okay, so today you skillfully set up one of my favorite people in the whole wide world, who's back and better than ever. Ladies and gentlemen, introduce our special guest in studio.
We have Dr. Austin Bancroft with us today. Good morning.
Good morning. Thanks for having me.
You
for
are
coming.
awesome. Did you make it okay with all the crazy
Well,
construction?
there's construction, the traffic on my way in. I thought I sneakily got out a few minutes early, and I'll tell you what, I kept thinking I'm going to be late, which is not unusual for me to slide in here like a couple minutes before if I'm running late. But this time the traffic, there was just so many cars. It was slow going, and
Yep.
goodness gracious.
So it's us three working today, I think, Doc, just so you know.
Everybody's
we're working
out
hard.
cruising around doing something.
Well, it's great.
So-
There's a lot of families and there's a lot of issues. And one of the things that we threw out, I'm so glad to have you back here in studio, is that whole thing surrounding allergies and then some.
Right. Could you start by telling us what kind of doctor you are?
So I'm a board certified ear, nose, and throat surgeon. So I see common complaints, ear tubes and tonsillectomy for kids, to sinus disease, allergies, to even some head and neck cancers and thyroid disorders as well. So
Wow.
do the full gamut, pretty much neck up, except for the brain and the eyes.
So that has to keep things interesting. That's a lot. We know, actually, in the springtime, we discussed an article that you had written about allergy season, that they were projecting the spring and summer season to be a little worse than normal, just because of the winter temperatures and stuff. So as we warmed up, we had a discussion about that on the show. Just Rick and I had, and actually talked to one of our LaPorte Hospital pharmacists about that, kind of how to manage that. But I'm curious on your end, do you have a lot of people then that deal with serious allergy issues?
We do. We absolutely do. So like you mentioned, with a mild winter, a lot of the things don't get killed off, like mold overgrowth that would normally be subdued somewhat in the winter. And so not only do we have tree pollen kind of coming down off of its true peak, but now the 4th of July is typically the peak of grass pollen season.
Really?
So you have that, and then also you have a larger amount of mold from a mild winter. So it has been kind of a rough springtime for a lot of allergy sufferers.
I want to ask this. So we're talking
Please.
allergy. You have two people in this room here on Younger Life Live, Mary and Rick, who don't suffer from allergies. Correct? Am I right on that?
Never suffered allergies before.
But I will tell you, this year, Doc, it has been for me. I feel, even today, I feel stuffy. My ears, I know you're talking ears, nose, throat. Even yesterday, you had a small tickle.
I get it. I've had this spring has been the worst, the scratchy. I get a little hoarseness going on in my throat, so much worse. And I said, I wonder if it is allergy related. And I've never had allergies or experienced allergy issues.
Have you seen that happen with a lot of us non-allergy type guys and gals this year?
Absolutely. One of the most interesting people, not everybody with mild symptoms like you guys are describing need to see an ENT by any means.
Right.
But especially you have people that come in and they say, I just have this cold I can't kick for 3 weeks. That's not typical for a typical viral cold.
Right.
And so especially if it's over the spring or over the 4th, that's something where you have to say, is there something else? Could I just have inflammation from chronic irritants? And so if it's mild, doing a trial of like an over-the-counter antihistamine such as Zyrtec or Flonase, which is a low-dose steroid nasal spray, is definitely worth a 1-week trial.
Oh, so within a week, you should see a difference or notice a difference within a week?
Absolutely.
Wow.
If it's allergy related, if you start an anti-allergy medicine, you should notice a difference.
Okay.
And if it's not getting better, that's one time that you would definitely want to go out and seek medical advice for sure.
When you say Flonase, I know you said that's a nasal spray. Are those, my concern with that is, are they addictive?
Good question. So Flonase, that's the trade name. The generic name is fluticasone. That is a low-dose nasal steroid spray. Those are not addictive. So there are some over-the-counter ones that are addictive. The most common brand names being Afrin or Neosynephrine. Those are the ones, they work great. They open you up almost instantaneously. But the problem is they only work for about 2 to 3 days. After that, they can make your symptoms much worse.
Wow.
So those you want to stay away from, for longer than a 2 to 3 day duration. But things like Zyrtec nasal spray or Flonase, which is the brand name, or Nasacort, those are all safe to be used as long as you're not ignoring symptoms, for a longer duration of time.
Can I ask this then? If you're looking at these sprays and some of these things, because for those of us that haven't, utilized that, doctor, how about from the perspective of those that may have high blood pressure, and don't mean to put you on the spot, high blood pressure or other symptoms that may affect them? For example, they can't have caffeine or they can't do A, B, or C because of maybe a medical condition and not, an ongoing one. What would you say to that?
Sure. Well, and some of these definitely should be, if somebody has a complex medical history, you definitely want to consult your physician before you add any medication to your regular daily regimen. But some of the common ones is pseudoephedrine or anything with D after it. Zyrtec D, Claritin D. Those are definitely going to increase your heart rate, can increase blood pressure. Wow. So if you have a history of high blood pressure or a fast heart rate, you want to stay away from those.
Steer clear.
And those are some of the big key ones. So absolutely, if you have a complex medical history, you'd want to talk to your physician first.
We say that all the time.
Yeah.
We are not doctors, Rick and I. So please, that's a great point. Ask your doctor. And I think, you probably work a lot with primary care physicians as well, and would hope that patients would encourage that relationship rather than that way you kind of know anything else that they're on, or can kind of work with that doctor. I think that's really important to point out. So this season alone, when will allergy season start kind of waning off a little bit?
Tapering off?
Yeah.
So a general rule of thumb is during the springtime, there's a peak of tree pollen that usually peaks somewhere around Memorial Day. So we're just kind of tapering off of tree pollen.
Okay.
Grass pollens are usually midsummer, somewhere around the 4th of July, so right about now. And then as those taper off into the fall, around Labor Day is kind of when weed pollen starts. Oh. And so it kind of alternates through things. As you go into winter months, that's more typical. If people only have allergy symptoms in the winter, you have to think of more indoor allergens.
Right.
Are they allergic to their pets? Is there a dust mite allergy? Is there a mold problem in the house? Because as you close up the house and you seal in all of that air, if you do have a mold allergy and you have a mold problem, a damp, musty basement or something like that, that can affect you then. So you do have sometimes those unfortunate people that have allergy symptoms year round, but if you only have symptoms peaking around the 4th of July, it's probably something like a grass pollen.
Right. Well, good. So would you suggest then, can some of these over-the-counter remedies actually manage your symptoms, or is it better to come and speak with the doctor and get on something that's more prescription-based? And if you could kind of tell me what the difference of the over-the-counter versus a prescription is.
Sure. Well, so if you go back about 5 or 10 years, most of the antihistamines that we use are now available over the counter.
Okay.
They used to be prescription.
Oh.
Now the FDA has found that, if you're using them for a short duration and your symptoms improve with this, they can be used safely, by the individual. So, if you're using it for less than a couple of weeks, you have minor symptoms, they go away with an over-the-counter antihistamine. I think that's very reasonable to use those on your own. But if your symptoms worsen or something just doesn't seem right, I would absolutely see your primary care physician.
You were talking with Mary and you were saying to the Younger Life Live crew, as you're chatting, neck up. And I, as a radio TV guy, Mary, you as well, we know how important those three go together. They kind of all tie in. So what would you say to those folks out there, no matter if they're the youngest of years or the wisest of years, and I fit right between, you're in the younger years, kiddo, about maintenance, about upkeep, about coming to see you, doctor? Should it be a couple times a year? And what should we be looking for? How many times a year should we see you? And what should we be looking for in symptoms or signs that something's up, that we should probably come and see you?
Sure. Well, like I've hinted at, most mild or moderate allergy symptoms can be controlled, by common medications, either prescription or over the counter, by working with your primary care provider. Definitely a time to see an ear, nose, and throat surgeon is if what you're working with your primary care provider doesn't work, or if you have something more serious, such as nasal polyps or nasal obstruction, or Hoarseness, you mentioned hoarseness. If you have hoarseness for 2 weeks or more and it doesn't go away, that should definitely be evaluated. You can't ignore that.
What if it comes and goes?
Yeah.
Wait, now
She
you're
wasn't
scaring
talking about
me.
herself, doctor.
Now you're scaring me. For a friend, I'm curious.
I got a
I
friend
like
that
that
has
joke. My friend.
Sure. Well, comes and goes. Everybody has kind of a dry, scratchy throat in the morning. So
Yes.
if it's mild like that, that's probably attributed to just daily life. But persistent hoarseness that will not go away is all day, all night for more than 2 weeks should definitely be evaluated by either an ear, nose, and throat surgeon like myself or a primary care provider at least.
This is why I love this guy. You realize how important he is to our life.
Oh,
Not only is he a
absolutely.
wonderful doctor and his colleagues, but he is for us.
Mm-hmm.
We have him on speed dial on our phones.
Well, it's definitely an important topic, and my husband suffers serious allergies. He's constantly having issues from spring, honestly, through fall. I mean, poor guy. He has a lot, and one of my daughters has mild allergies, and one of my sons has serious allergies too. So we've tried, lots of over-the-counter kind of thing. We've done a little bit of prescription for the kids at least to try to help. And because it does come and go, because it isn't all year, it's not indoor allergies. It's certainly outdoor. The over-the-counter seems to work just as good for us. That's kind of what we fall back to. But I read in the article about chronic sinusitis. Is that how you say it?
Sinusitis.
Sinusitis. Thank
Sure.
you. Can you tell us what that is?
So that's basically that's a basket term. The Latin just
Oh,
basically
okay.
means irritation of the nose.
Oh,
runny
okay.
nose, a chronic runny nose. That person that always has a drip, always has
Yes.
a sniffle, always has a drip in the back of their throat or maybe a tickle in their throat. And that can very commonly be, especially in younger age, an allergen to pollen, to pet, to
Okay.
mold.
Wow, that would drive me nuts. To have
That's
a
what my
constant
husband, that's
drip.
like his.
Seriously.
I mean, when his allergies are flaring up, it literally just constantly there's nothing he can do. There's
or is there? something
Well, I
you
mean,
can
that's
do?
it.
You know what I'm saying?
What does he typically take? I'm curious.
So what he takes a lot of times is, he's tried literally everything over the counter. I mean, he's done, I hate to call out brands, but he's done Tylenol and Advil, sinus and allergy. He's done, he's tried both of those. He's done Benadryl. Benadryl does really help, but again, the drowsiness, it makes us nervous. And so, that is a bedtime only, like last resort,
Yes.
just draining kind
Sure.
of, can't stop it kind of
So my
treatment.
go-tos, if it's hard because you hate to give medical advice just
I know,
blanket
certainly,
over the
absolutely.
radio. But assuming you have a healthy patient,
Mm-hmm.
a healthy individual who does not have a lot of other comorbidities, a good, solid, over-the-counter antihistamine is Allegra or Zyrtec. Those are the brand names.
Okay.
Fexofenadine or cetirizine are the generic names. And so Allegra specifically, if drowsiness is a big issue, that's a high-quality antihistamine that typically does not cause drowsiness. Zyrtec sometimes works a little bit better. But about 12% of people become drowsy on that. So if you're a truck driver, if you're a pilot, you probably shouldn't do something like that. But Allegra would be safe in those individuals because the drowsiness is much less.
Do you know, I do have to say we've tried Allegra and it really does help. He has pet dander issues with cats specifically. And when we go to visit family, we will stock up on Allegra, and about 2 weeks before we go, I don't even know if this is necessary, but about 2 weeks before we go, he starts taking it every day. And when we're there, so he doesn't, because to be in the house for 10 minutes, when we go visit his
affects
brother,
him?
it affects him so bad.
Yep.
So we start
My wife.
preparing like way before we go.
Is that
and
what-
it
normally
really
what
has
you
made
do?
a large difference.
That's a very good strategy, absolutely.
Okay.
Because if you wait until you have,
Good job.
congestion, especially if you know you're walking into an
Yeah.
environment that bothers you, if you're, cat allergic,
That's
like you're
it.
saying you're going to the Humane Society or something, you want to take something to try and block that release of histamine,
Okay.
because that's what antihistamines do. They have a harder time treating it once that reaction has happened.
Certainly.
But if you can stop it before it happens, absolutely. You probably don't have to do 2 weeks
Okay,
ahead.
I was going to ask you, is that a little excessive?
A day or
But
two would probably do it, yep.
but he just swells
crazy
up
kids.
too, and he just can't stand it. So that's what we've done.
Tammy is texting in, and she asked the doc if you wouldn't mind. You would mention nasal polyps. I'm worried that I have them. She said, "Can you have the doc describe it?" Is that, and not to be weird, when you say polyps, I hear that word and I think immediately something's wrong.
Yeah.
So can you describe? Would that be inside the nose, and would you be able to feel them inside your nose? Is that what that is, or
Yeah, so your reaction's very common. People hear polyps, and all they know about are colon polyps,
Yes.
and they say,
That's
"Oh,
it.
this is cancer."
That's exactly
It's
what I
scary.
thought.
That's
Cancer. I
exactly
didn't wanna
what
say
you
it.
think.
So
It's very
nasal
scary.
polyps very rarely are cancerous or precancerous, and so typically it's a completely different animal. A nasal polyp is usually from chronic irritation, and in surgery, what it looks like is a grape without its skin. It's kind of
Really?
semi-transparent. It's just this inflamed tissue that comes from your body overreacting to a common, most of the time, allergen. About 85% of people with nasal polyps have some type of allergen. And so the biggest reason that people would know that they would have it, if you have a bad case of nasal polyps, you have typically nasal obstruction. They can grow so big that you just can't breathe out of your nose whatsoever.
Makes me feel like I can't breathe anyway. I can't imagine being that
I
stuffed
literally
up.
had people with polyps so large that they kind of sometimes can poke out of the nose.
Oh my
Those
God.
are pretty extreme cases.
Yeah, but still.
Yeah. And so those can, the best way to treat them is to prevent them. If you know you have them, to treat it with like a daily steroid spray like Flonase or an antihistamine. Sometimes they do have to be surgically removed, especially if it's a new diagnosis. We oftentimes will start with that if conservative measures won't work. Just basically to give people back their quality of life and ability to breathe through their nose. As far as when would you know that you had them or not, really having a physician look in the nose. So sometimes in extreme cases, like I described, people can see them themselves, but most of the time it requires someone looking in the nose to
So
make that
they
diagnosis.
would just feel irritation or blockage. They would feel a little stuffy when nothing else feels stuffy. Or, I mean, like the breathing specifically.
Yeah. So
would be-
in bad cases, it can definitely completely obstruct the nose.
I mean, that would
so
be the.
here's the question related to that.
Yeah.
So you go to your GP, general practitioner. I get a physical. I do a couple times a year at my age, and he looks in my throat. He looks in my ears, but he looks in my nose. What is he or she looking for?
Good point.
And I don't mean to kind of
Good question.
ask the question, but I want to know what they're looking for now. Or is that what they're looking for?
That's one of the things they're looking for. Absolutely. Especially when you're going in for a general physical,
Right.
It's kind of like when you take your car to get the oil change, they'll check the brakes for you at the same time. They're kind of making sure everything looks all right. So they're probably looking in your ears to make sure, hey, I don't see any signs of fluid or infection. And the nose for any obvious obstruction, absolutely. And same with the throat, any abnormality, any a good test for people. If you're looking at something, now Google is the next physician, but does one side match the other? Does one side look like the other? And if it doesn't, there might be a reason to look into that further. So a lot of that is just looking at, hey, let's look in the throat, let's look in the nose. Does it look the same on the right versus the left? Does anything look abnormal? So that's the kind of stuff they're probably looking for.
And
That's good.
And it's not
That's a good
because
question.
I do the radio TV thing, but this to me is the most fascinating part of the body in terms of what Dr. Austin Bancroft does over here. Because think about when your ear starts bothering you, you could feel that like you
Oh,
try to
absolutely.
swallow and it's going behind your ears, it's in your throat or it's in your nose. This may sound dorky, but I think it's the coolest thing in the world. I mean, just personally, and you're like, yeah.
Can you tell
Absolutely.
us how long you've been doing
Yeah,
it?
this is
While we're
great.
talking
So
about it.
yeah, it's a long process. So I've been a physician for 8 years now. I've been doing ear, nose, and throat for 8 years. And so the typical road to get to where I am now, you have 4 years of undergrad at minimum. You have 4 years of medical school. A typical residency for ENT is 5 years, and then practice after that. There are some people that even do additional training beyond that, like if they wanted to do specific training just in ear surgery or more advanced training. But that's the typical ENT.
Wow.
Was this something that you wanted to do as a young boy growing up, or was this something that you went to school and you kind of saw yourself, oh, this is really cool, and then you jumped into it? What, just kind of a thought on
The
that?
second, absolutely
Yeah.
the second. So I knew I wanted to be a physician, and then when I was in medical school, I took a year off to teach and do some research, and I really fell in love with head and neck anatomy, and that's kind of what planted the seed.
That's
So,
neat too. And I think that it would be difficult for a child to go, unless they had a relative that was an
Right.
ENT, to go, I'm going to grow up and do ear, nose, and throat.
Right,
Just
right.
because
I love
there's,
it.
you wouldn't really know what it all involves. It's really cool. And it's neat because not just do you just treat, patients in the office, you get to do surgery too, which is really, really neat.
Yeah, that's why I love what I
It's
do.
really
So-
interesting.
So I see 2-week-olds or
Yeah.
2-day-olds. I see 95-year-olds. I see ear tubes and I see head and neck cancer. So it's really great variety. So every day is a little bit different, which
That's
is terrific. Yeah.
In your studies, doctor, and some of the things that are going on, I know recently my wife, we went with her father because as he gets a little wiser in years, his hearing went out because of what he did for a living. He worked as a machinist, and so he was around loud stuff all the time. Do you, in your line of work, do you work with folks too that may have to have, utilize hearing devices and stuff like that? Just curious.
We do. So we have 2 offices, one in Michigan City and one in LaPorte, and we employ 2 audiologists, and we do a full service hearing center. And so, like you're describing, someone older, more mature in age, and they just notice a subtle decrease in their hearing, they don't even sometimes need to see me. They can even make an appointment with one of our audiologists directly, and they can evaluate the hearing as not only a screen, but also to recommend or not recommend hearing aids. And then we also, for certain types of hearing loss, can sometimes require surgery. We also offer implantable hearing aids as well. So we really offer a pretty full service array. Yeah.
That's really neat. About allergies, I was going to ask, do you test in the office then? And what does, you hear about allergy testing. I don't really know how that's done. Could you share with us how that
Currently,
takes
we
place?
don't. I'd love to expand our practice to do that. That is something that I was trained on in residency. And there are 3 general ways to do that.
Okay.
Number one, your husband's the great example. He's maybe never been tested, but as soon as he comes around a cat,
Yes.
he's allergic to it. So that's just trial and error. So you can always, do an elimination trial or a presentation trial. Hey, you eliminate the cat, do your symptoms go away? Do you come around the cat, do your symptoms get worse? That's the most crude and cheapest, but sometimes most people do that on their own before they come to see us. And then as far as formal allergy testing, the 2 most common ways that we do it is, one is a blood test. We look for antibodies, which are proteins in your blood, to see if they react to specific allergens. That works relatively well. That's a great way. Can be somewhat expensive. And then probably the most sensitive way to check for allergies is where they present small amounts of specific allergens to people's skin. So they'll put a small scratch with an allergen in it and see, does their skin mount a reaction to
Let's do that with you.
We'll let you be the guinea pig for that. I've actually heard of that. That's what I was I'm intrigued by that, the process of that, and trying to figure out. So you're not actually injecting anything. It's just a scrape. It's not a shot.
It's not
per
a shot.
se.
Yeah.
This is what I've heard, and
so that's probably the most accurate way to do testing. The blood testing is also very accurate, but it can miss about 5% of people with allergies.
Okay.
So the skin testing is probably the most accurate, and most of it is just done with a scratch on the test or on the skin surface. And without a deep injection.
Can I ask 2 people now? I've asked for your numbers since you said LaPorte, Michigan City. So I've got a really cool picture of you that I'm posting on WIMS's Facebook.
Sure.
Can I please have a couple of numbers that folks can get a hold of you either in LaPorte or Michigan City?
Sure. It's the same office number. It is area code 219-325-3770.
Okay, perfect.
And that is if you wanted to see one of our audiologists or one of our ear, nose, and throat surgeons. It's the same number for both.
Okay,
Fantastic.
so I'm going to post this right now just because this is great information. And a lot of
It
us
is
are
great
affected by this.
information.
It so all ties together.
well, it definitely does. But it is it's great information because it affects so many people. And even if it's small scale, even if it's just the scratchy throat every now and then, versus, my husband or the couple of my kids that are really affected, it just affects, it seems as though it affects everybody in some way. So especially knowing this year was going to be a little bit
More challenging.
More challenging is a good way to put it. A little bit more difficult, So I think it's definitely important. And what about allergy shots? I do know of families that have had children with such severe allergies that they take their kids for regular allergy shots. Is that something that we should look into if our kids?
So what allergy shots are, basically if you've gone through formal testing and you've found I'm allergic to cats, I'm allergic to oak tree pollen, and I'm allergic to dust mite. Okay, so you know what you're allergic to.
Right.
What allergy shots do is they present small amounts of what you're allergic to by injection on a weekly or monthly basis
I see.
to basically try and change the response of your body. to try to make you more tolerant of specific allergens. It's a great long-term solution, but it does not. So, for instance, your husband's example is a great example. You take a pill, you're better for a couple of weeks, great. This is something that you have to do on a regular basis for probably about 2 to 3 years or longer on a regular basis try and avoid that reaction.
Then at that point, correct me if I'm wrong, it goes away little by little. Once you do those shots for a couple of years, it's less and less, correct? Like, let's say you have to go, 3 or 4 times a month, then it goes down to X amount of times per month, then it goes down to, once a month. Is that correct or no?
So that's the goal. Absolutely, that's the goal. So if you look,
my wife.
Yeah, if you look at data, the hardest
in earlier years,
the hardest allergies to get to completely go away long term are going to be molds and pet dander, especially if there's a continued pet or mold exposure. But especially for people with pollen allergens, those can definitely they all can decrease over time, but those are the most susceptible to a treatment like that. So as far as long-term data, this works really good on the 3 to 5 year scale. There's not a lot of studies that go beyond 5 years.
Really?
Just because it's hard to keep a participant in a study for more than 5 years. So some of that is unknown, but yeah, it has been used for decades.
You're going to love this question. Someone just said, I wanted to get a lab. They said I couldn't because I was allergic to the pet dander. Is there a shot out there that I could do so I can get my lab?
Oh, like a Labrador. Okay.
Yes.
Okay. Yeah, so absolutely. If so that would be an example where you definitely could work with an allergist. We don't have allergy shots available at our office, but there are allergists in the area that do, where sometimes a common situation like you're describing is someone that has a lot of allergens, or they want to go to veterinary school, for instance, and they say, hey, I'm fearful that I may generate allergens. So in those situations, you can work with an allergist, and sometimes if it's appropriate for that person, you can work to desensitize yourself over time. Now, like I said, pet dander it definitely can be helped with allergy injections. It's definitely a good primary use of that. But long term, that might be something that she continues to need to have done. It might not just be a 2-year cycle and you're done. That might need something that needs to be done long term. So.
Isn't that interesting? You're a pet lover, as a lot of us are.
Oh yeah, I would be so sad if if one of my kids or myself or my husband couldn't have our pets. But are there you see hypoallergenic pets? Is that an actual thing, or does that? I laugh and think. They still have fur.
Yeah, well, they still have skin.
They still have skin. Yeah. It's still an animal. I'm not exactly sure how they could have no allergy. They couldn't so there's trigger an allergy.
None is probably not, unless you can get a skinless dog or a skinless cat.
Yuck. Thanks anyways.
That'd be cool.
Yeah. But so there are definitely people will swear by it. Hey, this dog doesn't bother me as much as this, or male cats bother me more than female cats. It's hard to objectively quantify that with research studies, but anecdotally, I think that they're definitely out there for sure. But they all have skin. They all have the protein that can cause, an allergic response. And even cats, sometimes it's actually a dried protein from the saliva from them cleaning themselves too. But also, the other thing, if you have just a mild allergy, simple things. You can't forget the simple things. Bathing a dog on a weekly basis.
Certainly.
Brushing vacuuming your house, having wood floors instead of carpet, so that dander just doesn't stay in your house as long. So.
There's a couple things you're going to love this, and this is where I wish that the visuals. I could literally take some of these text messages. Go to my camera really quick. I just want to show this. There's a text message here, right? But I'm going to read this to Dr. Austin Bancroft. And if you're eating right now, Mary and I apologize. You notice how I pull you into this. Here is
this one
the
must
question.
be bad.
This is like a good one.
Those are our favorites.
This is gross, doctor, but the color junk that comes out of my nose is different. Sometimes green, sometimes yellow. Why? Does it say any time about what's going on inside of me?
So this has specifically been researched. People often say, hey, it was yellow, now it's green, it was clear. There's actually very little correlation between color of mucus and what's causing it. Yeah, which is surprising. It was surprising to me when I first read that. It is surprising.
You hear old wives' tales. They're
if it's
fine.
Yellow, you're big time.
But you better call your doctor if your kid's nose is that.
Sure.
That's funny. I love that.
Yeah, I mean, it makes sense. You think, oh, hey, it's a
Right.
different color. It must be so much worse. But research shows that if you culture that, there's not a lot of difference.
Wow.
And it's not a good predictor of, what type of treatment you need. There are some things you can do if you look at it under a microscope to figure out, is it infectious versus an allergen?
Mm-hmm.
But just looking at the color, usually not the case.
So don't panic, right?
Yeah, don't panic. And then also, while they're bringing that up, that brings up a great point, especially for kids. A lot of people are very nervous about, what medicines can I use with my children?
Certainly.
And especially little kids, if they have allergies, they have little noses. And if that little nose gets plugged up, if that mucus stays in there, it can harbor bacteria and it can cause infection. And so one thing that's safe for almost every single age out there is nasal saline. So basically, if you don't want to use a medicine, just clean it out. Just like trying to prevent infections anywhere in your body, keeping an area clean. You can't overdose on nasal saline,
Right.
And it's safe for anybody. You're not going to be allergic to it unless you're allergic to one of the preservatives, in which you can get a preservative-free one. And so that's something that it's underutilized and can be very effective.
I'm so glad you brought that up. I actually put that in my questions, that when I knew you were coming, I was making mental
What, about
questions
the
and
mucus
jotting them
color?
down. No, about the saline, because like I said, my two kids that suffer from allergies, we've always used that nasal. It's just a nasal saline. That's all it is. So it's not medicine. I don't have to worry about if I'm trying to put it in their nose and they fight me and it goes in their eye. It's going to sting because it's saline, but it's not going to hurt them. I don't have to worry.
Not addictive?
No, not at all. I don't have to worry if it gets in their mouth. It might taste gross, but it's not going to hurt them. And I don't have to worry about how many hours has it been. If they're stuffy, it works fabulous.
It does.
And it really it's extremely effective, and it does seem to help them, especially when they're really battling with it's running, but they still feel stuffy. It really makes such a big difference. It makes a huge difference. So I put that in my notes to ask you why. I'm glad you brought that up, and so obviously that's still good to use for everybody, every age group, right?
Yeah, you're not going to have somebody, like I said, unless you have that rare person that's allergic to the preservative in it, and by preservative, just something to keep it safe on the shelf.
Right.
And those allergies are rare, but that's going to be safe for almost any age group.
And it's available at the store, which is nice. You don't have to worry about.
And it's cheap and it's effective.
It is. It is, and it's
Now-
a little bit more. I don't want to say natural, but it is into medication.
At your home, if you don't want me asking personal question,
Go for it.
But at our home with Norma, Carly, and Devin, Doc, we can't have any rugs because we have all wood floors pretty much. So at your home with the allergies, do you guys utilize rugs, or does that not affect them?
We did. We had carpet, and we did remove the carpet. We still have carpet in the bedrooms. And I remember when one of my daughter, who's 13 now, when she was younger and having constant issues with
Right.
her allergies and stuff, our pediatrician had suggested pulling the carpet out of the bedrooms at that time, which we didn't. He said, "Oh, really? Do we have to?" But I mean,
it's a lot.
it does, and she has over time actually improved. So are allergies something you can actually outgrow? Is it?
Yes. So you can generate or get rid of an allergy at any age. So
Okay.
if I have a 50-year-old come to my office and I think they have allergies, they say, "Look, I'm 50. I've never had this before." You can develop an allergy at any age, and they can potentially go away. A lot of times with kids, it's not so much that they go away, but their anatomy gets bigger. So in a very tiny baby, a 1-year-old or a 2-year-old, if you have a little bit of inflammation inside of your nose, it can block it.
Very true.
Where an adult-sized nose, that same amount of inflammation might only cause minor symptoms.
About allergies too. This is wonderful conversation. Two of my kids tend to get hives when they are. It's not necessarily pollen related. That's more nose, much more nose. If they are, my daughter loves horses, and we don't know if it's the horses, the dander, or if it is actually the hay at the barn. But when we leave the barn, she and my son that has the allergies, a lot of times they get like hives. Not terrible, like huge inflamed. I give them Benadryl, it goes away afterwards. Or the Allegra works really well for my 13-year-old to help prevent that also. But is that normal? I mean, she'll even get them on her ears. They just come.
Really?
And I've tried to say, I think you're allergic to the horses. And she literally, the first time I said that, she cried and said, "I think it's the barn cats or the hay." I think
How did that go again?
I think it's the barn cats. She's just petrified that it's actually going to be the horse.
She
or-
enjoys doing
definitely
it.
the pollen from the hay or the horse. In those situations, testing can really be very helpful.
Okay.
Because you don't want to ignore symptoms that might cause difficulty with breathing.
Certainly, that would be very scary.
Yeah, so that would be a perfect implementation for allergy testing.
Here's another one. Ask the doc. I've seen singers shoot that nasal saline into their nose to keep their vocal cords moist.
Ew.
Does this really help? I'm a musician. Ooh, this is look at these good questions.
Dude, that's gross. You're going to taste it.
If you're shooting it all the way in your nose and it's getting all the way to your voice box,
Yeah.
that's a pretty aggressive shot of saline. But
Yuck.
now, if you're just talking about voice, hydration is definitely key.
Okay.
So the way that you generate voice, it's kind of a beautiful thing that happens. You have this very thin layer of jelly that's covered with a very thin mucus. And it's that wave that's generated from sound coming through this small jelly-like layer that makes the sound waves that produce voice. And so moisture is key for sure. So if you've ever seen someone who's on a bunch of diuretics or drinks a bunch of coffee, which is also a diuretic, you can oftentimes become hoarse just from having thicker mucus that doesn't.
I think we just nailed my problem.
Caffeine is one of the
I
most
love
common
coffee.
diuretics. Yep.
So do I. Are you kidding me?
It is a mild diuretic.
Right.
So it can definitely dry
I
you
was
out.
aware of that, but I
was not,
I didn't
thanks.
attribute that to my hoarseness. So
It definitely can.
Well,
cause
wait.
hoarseness.
So you're saying water, but a lot of us. I mean, I've been doing this for 32 years. So for me, I love coffee, and I at least have one glass a day during morning shows and this. But I guess then I want to ask you, does the teas, the OJs, does that stuff affect your cords too? I'm just curious because I
Kind of
like
a complex
tea, but I love.
answer. So caffeine-wise, if your tea has caffeine, it's not the coffee that's the diuretic; it's the
Right.
caffeine in the coffee.
Right.
And so teas with caffeine, yes. Orange juice, probably not because it's not a diuretic.
Okay.
But now, if you switch gears, sometimes, and if you're just talking about hoarseness now, acid reflux can also be a common cause of reflux. And sometimes people do report if they eat something acidic like tomato sauce or orange juice, that can trigger their reflux, which could make you hoarse. So different mechanism.
Right.
But yeah, potential.
Look at that.
do you treat a lot of that?
We do.
A lot of that, yeah.
We teach a lot. Well, hoarseness especially, like we talked about, if you've got hoarseness that's persistent for more than 2 weeks, it should be evaluated as a general rule of thumb. But a lot of that, again, if you're doing well with your primary care physician, just with medication therapy, that's the place to go. And really, if they're having struggles or if they need additional help or if they want somebody to look at the vocal cords to make sure they look healthy, that's where our role comes into play.
I meant the acid reflux as well. Do you see a lot of that?
We do. And when we typically see it, it's with people that have atypical presentations. So if somebody has, hey, I have heartburn and I feel food come up, and
Is that what technically heartburn is? Like when you
heartburn is acid coming up
Right.
the esophagus,
Right.
and sometimes people have discomfort from that. Yep.
and they taste it in their mouth, correct?
Yep. And so that's called water brash is the scientific name of that. But
That's the name of your new band.
water brash.
It's fun.
But Doc's going, I like this.
There
He's
you
lead
go.
guitar. Well, if you feel that, because there are times, and this never affected me as a young kid, but I'm just going to be real honest now. There are times, I love Mexican food. I love Italian. I'm Italian and German. But there are times that I'll have a sauce, like a lasagna. And it's not when I'm eating it. I'm fine, small portion. It's when you go to sleep after you brush your teeth and all of a sudden you're laying there. And we've had discussions about this on this very show.
We've talked
Younger
a lot
Life
about
Live,
acid
where all of a
reflux.
sudden you're sitting there and you're like in a calm state and you're like, you get woken up by that crazy for a moment. Is that you're looking at me?
Yeah, that's textbook.
Wow.
Wow.
So
I've only
those
had it
acidic
once.
foods,
insane.
eating within 3 hours of bedtime is another risk factor.
Oh.
And you're having lasagna, you enjoy a glass of wine with that.
Oh, yeah.
That alcohol relaxes the muscles that keep food down, and it also promotes acid reflux. So so all of those things together,
Yeah.
a great Italian meal is a terrible thing for reflux.
Okay. So
It's a storm in the making right there.
right there.
So, it's funny. I've only had acid reflux heartburn once ever that I can recall when I was pregnant. I know people say
Yep.
all the time that's very common in pregnant people. I never had that issue, and one day I have this just weird And I was telling my aunt, who's a nurse, and she said, "Mary, that is heartburn." I said, "That's funny. I've never had it. It's the only time I've ever had it in my whole life."
Right.
Yeah.
So I didn't really think about it because I just am not really prone to that, thankfully.
See, now I'm thinking about wines, and I'm thinking, well, this makes sense because 3
It does make
hours
sense.
before bed, think about it. I
Right.
always try to, eat dinner, and then I brush my teeth right away, especially as I get older, because then I don't want to eat anything else because I'm trying to watch the stomach area, obviously, as a guy. But I'm thinking about the wines. You have one glass, whether it's the white wine or the red wine, either one's going to affect you, I'm assuming.
Yeah, the
correct?
alcohol.
Yeah.
Right.
Yeah.
Yeah, that makes
Alcohol,
perfect
whatever.
sense. Being a relaxant, that makes perfect sense. So it is encouraging, though, after speaking with you for the last hour, the people that are having just issues right now, it doesn't necessarily mean that they need to worry that something more severe is wrong. This just could be related to the peak in season
Yep.
right now.
Especially with grass pollens right now.
Try, obviously then, so all these medicines that you can buy, these different drugs you can try, they're all a little bit different. So should someone say they try, I again hate to call out a brand, say they try Claritin or something, should they then say, this did nothing for me, try something else before going to a doctor?
Yeah. So, if you're having symptoms that are not responding the way that, the package is describing that they should respond to a condition, it's always possible that you have the wrong diagnosis. And so seeking out professional medical opinion in those situations is definitely worthwhile. You never want to ignore something and just keep, next thing you know, you've tried 8 different things. It's been 6 months and now you have something serious that you've ignored. But if you look at just regular over-the-counter antihistamines, Benadryl or diphenhydramine is going to be the oldest one, probably the most sedating. And so a lot of people don't like those, like
That's
you're
it.
talking about, unless they're about to go to bed. Claritin was one of the first non-drowsy ones. It works good. Fexofenadine, which is Allegra, or cetirizine, which is Zyrtec, probably work a little bit better than Claritin. I try to get people to start with those. But if that's not working and you just feel like, hey, I'm not getting any better, that's time to go ahead and seek out.
I
Very
would
good
love
point.
to have that piece he just said. I'd like to have that as just a little audio 30-second piece to play it because
It's a great
lot of
point.
folks, that's a great resource. We have Dr. Austin's information up on the WMS Facebook page. He's got 2 locations, LaPorte, Indiana, Michigan City, Indiana. I love
Can you tell us where they're at?
Yeah, please.
So the LaPorte office is a little bit tucked away. We have a beautiful location just off of Clear Lake. It's about 6 blocks from the hospital. It's 304 Detroit Street. And then here in Michigan City, we are right near the Culvers on that frontage road. There's a large IU Health building there, so we're in there.
Holy cow.
Yeah,
You
very
know what I'd
good.
love to do, and I did this when the exact location you were speaking about, we went out and did a live broadcast. I did on the air live the audiologist thing where the
Oh, yes,
kind
the
of,
hearing
I remember as a
test.
little
Oh,
boy,
the
you
hearing
raise your hand
test.
in Catholic
Certainly,
school and
your
stuff.
school nurse does
I
that.
would love to maybe take this on a Younger Life Live, field trip and do some of this stuff live.
Well,
if you don't
I think
mind.
that's always
Oh,
sounds
I would love to
absolutely.
visit your office. I find this stuff, especially Doc here, I find this very fascinating.
Oh, it is fascinating, and this is a doctor's office that is never going to be. Sometimes of the year, you go to the pediatrician this time of year, it's a little slower because you don't have flus and stuff. It's not as often, obviously, injuries and illness, whatever. But the common things. But your office is just
Poppin'.
constantly going because these things
We do.
never stop.
It's a busy career.
These things never stop, right? There's no real lull in there, where there might be with other things. So
What would you
it's
say
very
to
fascinating.
the young guy, the young gal that's listening, or a parental, and they're trying to say to their young one, okay, this is what you want to do. A lot of hard work, a lot of dedication. What would you say to those individuals, being that you're a young guy and you did it and you're doing it?
As to pursuing
for a
this
career, yes.
It's a great career. I love what I do. I love the variety. I love being able to do something different on a patient-to-patient basis. That variety of never knowing exactly what's next keeps it very interesting. It does take a lot of hard work and time, but it's definitely worth it if it's something that your heart wants to do.
Absolutely. I think that's
It's
great.
wonderful. Yeah.
I'm still chuckling to myself about the jelly thing in your voice box.
Yeah.
Thinking that was a very poetic way to describe something that's pretty gross. It's just funny. That was nice. So I find it very fascinating, really. it really is such a broad career, and that's really neat. And the allergy portion is such a small portion of what you really do, but affects so many of us. So it's really a good discussion and lots of good points in there, you know.
And I think the cool spin to this as well is you and I enjoy what we do in our professional and personal lives. Dr. Austin, of course, the same thing, but that's what I feel keeps it going. It doesn't matter how many hours you put in every day. It's just something that is really awesome.
Right.
You have fun doing. And I always say, and I'm not trying to be morbid here on a holiday weekend, but I said I'm going to die on the air, like talking on the air. I'm just going to fall over.
There you go.
I hope not during a Younger Life show. That would be really bad for me.
Here's a good question as we round up to the back end of Younger Life. Could you please ask the doctor what could cause the ear to ring and what could be done to fix that?
Yeah, so this is a very common complaint that we see in our office.
Great question.
So the most common cause of ringing in the world is hearing loss.
Really?
So we see a lot of people 55 or older, or sometimes even younger, especially if they've worked in a factory or have had a lot of loud noise exposure, and they've had permanent, sometimes hearing loss, and for some reason your brain replaces that hearing loss with an annoying ring or buzz or hum.
Right.
And so there are some other common causes. Aspirin, ibuprofen, NSAIDs can definitely cause ringing. So if people are taking too many of those, if they sprain their ankle and just really load it up on ibuprofen, that can cause ringing. Alcohol, tobacco, and caffeine as well. So those are the common lifestyle modifications that if someone's taking, you know, they live on caffeine and cigarettes, that could definitely
Younger
cause
life.
ringing.
Let's hope not. You better call your doctor if that's what you're living on.
that can attribute to ringing, but hearing
That's
loss is
another
definitely
show.
the most common. And so things to help is stopping those things that can cause it.
Right.
If you have a hearing loss, hearing aids can definitely help it. And also masking devices. So if you have an annoying ring that just keeps you up at night and that's all you can hear, turning a fan on just so it doesn't bother you as much can sometimes help.
That makes great sense.
Wow, that is another solid, great piece of information.
That's
I
a
never
great point
thought
about
that.
hearing loss, because I feel like a lot of times people don't realize that your
Very
hearing
true.
loss is very slow most of the time, unless there's obviously some major event. But for the most part, it's, it goes little by little. So I feel like I have an aunt that actually is the nurse. She didn't realize until she could hardly hear through her stethoscope that she was struggling to hear, that, she didn't even know.
Well, and she recognized it. Oftentimes we get the husband saying, you need to go in, or the wife saying, it's time to go
Yes.
in. I'm tired of yelling at
We're
you.
yelling and you're not
Yes,
hearing.
yeah.
Yes. I think that's a great point. So if you are hearing ringing, obviously call your doctor. But are there other little subtle signs that possibly, as far as hearing loss goes, that may be a red flag to
So
someone?
for hearing loss specifically, ask the people around you.
Okay.
The worst thing about hearing loss is that when you have that individual who maybe doesn't want to admit that they have hearing loss, but they know that when they go to a restaurant they can't hear their friends, and so they stop doing those things. And that's the worst person, because you see this person that could easily be helped with a simple hearing aid or other things that are out there as well, that is withdrawing from life, and,
That's sad.
and now they're that leads to depression and decreased
Certainly.
life satisfaction.
It's sad. I mean, your quality of life absolutely is diminished when you have to put the brakes on those things because of hearing. And hearing aids now are so different anyways.
I'm so glad you brought that up. My father-in-law just got his hearing aids, and you cannot even tell. I'm looking right at him.
Yep.
I mean, you can't even tell that they're in his ears. And I made this comment to another one that's probably listening in my family right now that could use some hearing aids. What? It drives me nuts. You know who you are, Mom. I didn't say that on the air, did I, live? But there are people out there that don't want to approach that because they, maybe they're vain like myself or whatever. They think it looks weird. He can't even do it. But I could tell you his quality of life is so much better.
Oh, absolutely.
He bonds with us. You could tell because he said it was because of factory. I also have on the side note of that, and we've chatted with folks that were in the military where maybe they were in a position where things have happened in their lives and they were in action. And they've lost it and they have that ringing or whatever. So I want to throw that out there to our great military friends out there, veterans and
Seek
family
help.
members. Please,
call
This is a
the
great
office,
guy.
especially knowing
Please.
you're a full service.
Yeah.
And
even if it's difficult to get in with me, you can easily see an audiologist, and they can screen you
That's
for
fantastic.
the need for hearing aids. And especially you brought up veterans. Oftentimes insurances don't like to cover hearing aids, but VA assistance, if there's any attribution to your line of service causing that, will cover hearing aids, and they're very good, high-quality hearing aids as well.
Good.
They have to be serviced at a VA, but you don't want to miss those opportunities because it's an investment. Hearing aids, definitely cost money, and so you don't want to pass up the opportunity to possibly get that for a cheaper discounted rate.
Absolutely.
And I'm going to say it's worth every penny.
Absolutely.
I see it firsthand. I just witnessed it in the last couple months.
Well, I think of it in the same sense of my glasses or contacts. I cannot see anything.
It's one of your
without
five
them.
senses.
You have to, right?
Yeah.
And if you can improve that, if that is going and you can improve that, don't miss out on that chance just because of vanity or being afraid you can't pay for it. There are plenty of ways that there's help, and I know you guys in the office staff are always so good about trying to help find those ways. So I think it's fantastic.
1 minute or less left. This is great. You're awesome to have here.
Yes,
We definitely want to do
thank you so
another
much.
field trip with you, Doctor. Can you please give out your phone number again and your 2 locations?
Sure. So we are in LaPorte and Michigan City. LaPorte office is 304 Detroit Street. Michigan City is 3777 North Frontage Road, right near Culver's. And our office number is 219-325-3770.
On behalf of us all at Younger Life, I'm Rick Federici.
I'm Mary Anthony. Have a safe 4th.